Bismillahirrahmanirrahim and Assalamu alaikum. Today the drug which I am going to cover in my presentation is ergometrin. We will study about ergometrin, what is ergometrin, what is the indication of ergometrin, rational use of ergometrin, and also its irrational use, and we will also cover the case study regarding ergometrin and dosage of ergometrin etc. So let's start those one by one. So first of all, what is ergometrin? It is an ergotyl colloid with uterine and vascular smooth muscle contractile properties. It means it is an alkaloid which is having the contractile properties for the smooth muscles and uterine muscles. So as it is having the contractile properties for the smooth muscles and uterine muscles, so we'll use this. It is indicated in the postpartum hemorrhage and post-abortion hemorrhage in patient with uterine atony. Now, what is postpartum hemorrhage and post-abortion hemorrhage? So postpartum hemorrhage is one of the leading cause of the death during delivery. Post-abortion hemorrhage, this because of the excessive loss of blood. So when there is hemorrhage, so there will be excessive loss of blood which may lead to the death of the patient. So for this purpose we use ergometrin. We also use oxytocin for this purpose, and both are having almost same properties. But now we are going to study ergometrin. So we will study about ergometrin. So what is the rational use of ergometrin? Ergometrin is injected intramuscularly at a dose of 500 micrograms following the delivery of anterior shoulder of the infant at the latest immediately after delivery. So it is administered at a dose of 500 micrograms. We can also give it along with the 5 units of oxytocin. So 5 units of oxytocin we give this. So because both are having same kind of properties, so it will be for the synergistic effect. So dose of 200 to 500 milligram we can use intramuscularly, or if there is a kind of emergency situation, so we can also use intravenously at a dose of 250 to 500 micrograms. So irrational use of ergometrin. So first of all, we will have to see what are the irrational uses. Irrational uses in irrational uses of the drugs are one of the most common problem. So irrational use means sometimes the drug is given uselessly. It is not required, or sometimes it is given at the wrong time. So using ergometrin in renal compromised patient, and sometimes we don't take complete history of the patient and start using the drugs, and which may cause severe problems. So if a person is having renal problem, he is renal compromised, or he is having a liver diseases, so you cannot use this drug. We'll have to switch to oxytocin. Using ergometrin with the inhibitors of cytochrome P3A4 such as tolindromycin, erythromycin, clarithromycin, so these all can result in the ergotoxicity. So if you are using ergometrin with all these kind of antibiotics, so it will lead to the ergotoxicity. So these were some irrational uses of ergometrin. Now interaction with other medicinal products. So ergometrins may interact with other medicinal products such as for the vasopressor effects of vasoconstrictors, symptomatic local anesthetics. Concomitant administered with the beta blocker may enhance the vasoconstrictive action of ergotyl colloid. So if you are using beta blockers, it will enhance the vasoconstrictive action of ergotyl colloids. So these were the interaction with the other medicines. Alternative brands. What brands we have? Alternative brands for the ergotyl colloids. So we have ergometrin maleate 2 milligram in every way, which is very much economical. We have ergometrin 2 ergometrin. We have migranal. So these ergometrin and ergometrin maleate and migranal, these both are available in Pakistan, so you can use either. Route of administration. Administration. So we use intramuscular route is usually used, and it is recommended, and it is mostly safe route. So we can give intramuscularly at a dose of 250 to 500 micrograms by slow injection, but we can also use intravenously, but it is intravenously used in case of severe emergencies. So we do not use it intravenously, but if there is any emergency, so then we use it. We can also use it orally. We'll have to use it 3 times a day if we are going to use it orally. So case study regarding ergometrin. So now there was no such case study regarding ergometrin. So I just searched a case study which is related to ergometrin. Because most commonly the case studies were regarding any kind of disease, but this is ergometrin is not a disease as it is a drug, so there was almost no case study regarding the ergometrin. But still I managed to find a case study which might be helpful. The patient has been admitted at a hospital. She was in her usual state of good health until one day prior to of admission. She complains of labor pain that started at 4 a.m. Weight of the patient is 65 kg. So it is the patient has came to the hospital. She was okay, but she complained labor pain at 4 a.m. and the weight of the patient is 65 kg. So what diagnosis? So current diagnosis is postpartum hemorrhage. But because of current diagnosis postpartum hemorrhage, vital signs, if we see vital signs, her BP was 130 by 90, so it's okay. Pulse rate is 78, that is also okay. Temperature is okay. Treatment. So after seeing her, the patient, we diagnosed postpartum hemorrhage and we studied the remaining things, vital signs. So what treatment we'll have to give? We will treat her with the ringgit lactate and uterine massage for 15 minutes for 2 hours, and then we will use ergometrin 250 mg as recommended. So it was a diagnosis and treatment. Now some references, so from which I have taken all the data. Allah Hafiz.